Bismillahirrahmanirrahim. Quote of the day: Be happy with what you have while working for what you want. Assalamu alaikum. Today, the topic of my presentation is an occupational disease classification and pneumoconiosis under kind supervision of Professor Dr. Saira Afzal. Learning outline of my presentation is about classification of occupational disease, pneumoconiosis, silicosis, coal workers pneumoconiosis, asbestos, bagasosis, byssinosis, farmer's lung disease, recent updates, and at the end, there is an MCQ session. In the end of this presentation, participants would be able to classify occupational lung disease and will be able to describe different occupational lung diseases. Classification of occupational diseases is based upon different factors. Disease due to physical agents like heat factor is responsible for heat hyperpyrexia, heat exhaustion, heat syncope, heat cramps, burns, and local effect. Cold is responsible for trench foot, frostbite, and chilblains. And due to light, there is an occupational cataract minus nystagmus. And due to pressure, physical agent, there is the patient suffering from Kazan disease, air embolism, and blast explosion. And due to noise, there is the chance of occupational deafness. And due to radiation, there is more chance of cancer, leukemia, aplastic anemia, and pancytopenia. And due to mechanical factors, injuries and accident factors are occurring, and burns due to electricity. Now comes the second classification, in which we categorize different chemical agents which are responsible for causing diseases like gases, CO2, carbon monoxide, HCN, CS2, ammonia, N2, H2S, and hyperchloride poisoning. And due to dust, there is the disease which is known as pneumoconiosis. And there are many type of dust like inorganic dust, which is responsible for coal dust, anthracosis, silicosis, asbestosis, and iron sidrosis. And then comes the organic dust, which is responsible for bagasosis due to cane fiber, byssinosis due to cotton dust, tuberculosis due to tobacco, and the farmer's lung disease due to grain dust, metal and their compounds, toxic hazards from lead, mercury, cadmium, manganese, beryllium, arsenic, and chromium. And different acids are also responsible, acid alkalis or pesticides, and solvents like carbon, bisulfide, benzene, trichloroethylene, and chloroform. And there are many diseases due to biological agents like brucellosis, leptospirosis, anthrax, actinomycosis, hydrated doses, psittacosis, tetanus, encephalitis, fungal infection, and occupational cancer, bladder cancer, lung and skin cancer. And in the occupational dermatosis, the most common is eczema and dermatitis, and psychological region in which industrial neurosis, hypertension, and peptic ulcer are most common. Now comes the pneumoconiosis. Dust within the size range of 0.5 to 3 micron is a healthy hazard producing, after a variable period of exposure, a lung disease known as pneumoconiosis, which may gradually cripple a man by reducing his working capacity due to lung fibrosis and other complications. The hazardous effect of dust on the lung depend upon a number of factors such as chemical composition, fitness, concentration of dust in the air, period of exposure, and health status of the person who are exposed to this dust. Therefore, the threshold limit values for different dust are different. In addition to the toxic effect of the dust on the lung tissue, The sugar imposition of infection like tuberculosis, imposition of infection like tuberculosis may also influence the pattern of pneumoconiosis. Important dust diseases is further categorized: silicosis, anthracosis, byssinosis, bagasosis, asbestos, and farmer's lung disease. As no cure for the pneumoconiosis is known, it is essential to prevent these diseases from arising. Silicosis. Among the occupational disease, silicosis is the major cause of permanent disability and mortality. It is caused by inhalation of dust containing free silica or silicon dioxide. Its occurrence has been uncovered in various other industries. For example, mining industries, pottery and ceramic industry, sandblasting, metal grinding, building and concentration work, rock mining, iron and steel industry, and several others. There are three types of silicosis depending upon their airborne concentration of the crystalline silica or dust. Chronic silicosis usually occur after 10 or more years of exposure. Accelerated silicosis occur during 5 to 10 years. And acute silicosis occur where exposure are the highest and can cause symptoms to develop within a few weeks or up to 5 years. There are different preventive strategies which are used to avoid from this disease, like substitution engineering, work practices, and use of personal protective equipments. Now we discuss what is substitution. Substitution, the silica means using a different, safer material in place of the silica containing substance. It is true that in some cases it is not possible to use a substitution in place of silica, but for many operations such as abrasive blasting, there are many possible substitutes, including those which are written below, like aluminium oxide, ambient, polycarbonate, cryogenic, polycarbonate, emergy, granite glass beads, melamine, plastic, novaculite, and polycarbonate silicon carbamide stainless cast. And in the engineering control, we keep silica out of the air by install a water hose to wet down the dust at the point of generation, install local exhaust ventilation. During rock drilling, flow water through drill stem, install dust collection system onto machine or equipment that generate dust, and use concrete masonry saws that provide water to the blade. Then comes the work practices, what employees can do to reduce silica intake. Participate in any air monitoring or training program offered by the employer. If possible, change into a disposable or washable work clothes at the worksite, shower, and change into clean clothing before leaving the worksite. Do not eat, drink, use tobacco products, or apply cosmetics in area where there is dust containing crystalline silica. Wash your hand and face before eating, drinking, smoking, or applying cosmetics outside of the exposure area. If using respirators, do not alter the respirator in any way. Use of personal protective equipment, PPE against silica includes respirator and mask. Respirator should be used only when the dust control cannot keep dust level below the recommended exposure level. There are many types of respirator, from air purifying to air supplying, and from a nose and mouth covering to a full body respirator. Next one is the anthracosis, which is also known as coal workers pneumoconiosis, and these are some pictures which are related to pneumoconiosis. Accumulation of coal dust in the lung and the tissue reaction to its presence associated with coal mining industry takes 1 or 2 decades to cause this symptom. The disease is divided into two categories: simple coal workers pneumoconiosis and complicated coal workers pneumoconiosis, or also known as progressive massive fibrosis. This is the difference between a simple coal worker's pneumoconiosis and the complicated one. Focal aggregation of coal dust and leaden macrophages. Patient have slight cough and blackish sputum. Occur after many years of work in the mining industry, and fibrous scarring appear, also known as progressive massive fibrosis, and also called complicated coal workers pneumoconiosis. And now comes the byssinosis. And the byssinosis caused by inhalation of cotton fiber dust, which is belong to a textile and fiber industry. The chief symptoms are chest tightness, shortness of breath, cough, and wheezing, typically occurring when patients return to a work after a weekend or vacation. Smoking significantly exacerbate the byssinosis. When detected in its early stages, byssinosis is reversible by eliminating exposure to the responsible irritant. When exposure continues, the byssinosis can cause a permanent damage to the lung, which is also known as chronic byssinosis. Treatment in the acute setting, patients are encouraged to consider alternative occupation or at least reducing the exposure in the work environment. Smokers should be encouraged to stop smoking in the acute stage. Treatment may include bronchodilators for symptomatic relief. Corticosteroids are best avoided for as long as possible, given only in severe cases. And in chronic byssinosis, there is a supportive measures in which use of nebulizer and home oxygen therapy. Physical activity and breathing exercise may help in the management. There are also some preventive measures like medical measures, engineering measures, and some other precautionary measures. In medical measures, pre-placement examination, periodical examination, medical and healthcare services, notification, maintenance and analysis of record, health education and counseling, practices good personal hygiene. Practicing good personal hygiene, washing hand and face before eating, drinking, going to the toilet and smoking. Do not eat, drink, smoke or apply cosmetics in area. Wear protective clothes and respiratory protection, and before leaving work, shower and change into clean clothes. Leave dusty clothes at a workplace. And in the engineering measure, design of building, conduct air monitoring, minimize exposure by controlling the creation of airborne particles, use of personal protective equipment, enclosure and isolation of a person where the dust level is high, environmental monitoring. And in the other measures to minimize dust emission and exposure to dust, law compliance mechanism, cooperation between management and workers and their representatives, a mechanism for the collection and analysis of data on occupational disease, collaboration with Social Security scheme covering occupational injuries and disease. Now we discuss the bagasosis. Bagasosis is the name given to an occupational disease of the lung caused by inhalation of bagasse or sugarcane dust. The symptom consists of breathlessness, cough, hemoptysis, and slightly fever. Initially, there is acute diffuse bronchiolitis. Diagram may show mottling in lungs or shadow. There is impairment of pulmonary function. If treated early, there is resolution of acute inflammatory condition of the lung, and if it is left untreated, there is diffuse fibrosis, emphysema, and bronchiectasis. There are some preventive measures for dust control. Measure for the prevention and suppression of dust, such as wet process, enclosed apparatus, exhaust ventilation, and in personal protection, use mask and mechanical filters. And for the medical control, initial medical examination and periodical medical checkup of the worker are indicated, and in bagasse control, by keeping the moisture content above 20% and spray the bagasse with 2% propionic acid, a widely used fungicide. Bagasse can be rendered safe for manufacturing use. Now comes the asbestos. What is asbestosis? Asbestos is a chronic disorder of the lung which results from continuous inhalation of asbestos fiber over a prolonged period of time. These are the findings which are found in the chest X-ray: small irregular oval opacities, interstitial fibrosis, and the shaggy heart sign are also seen in the chest X-ray. These are the preventive measures which are taken for controlling the asbestos: use of safer type of asbestos, substitution of other insulants like glass fiber, mineral wool, calcium silicate, and plastic foams, rigorous dust control, periodic examination of a worker, and continuing research. Farmer's lung. Inhalation of moldy hay grain dust, less than 30% of moisture, favors bacteria, fungi growth, rise temperature 40 to 50 degrees centigrade, and favor thermophilic actinomycetes. Micropolyspora fini is the main causative agent of farmer's lung disease. Repeated attacks cause the pulmonary fibrosis damage and leads toward a cor pulmonale. And in the investigation, chest X-ray is done, in which a diffuse small 1 to 3 mm nodule or infiltrate something ground glass change in the apex, sparing and the normal in up to 20% of cases. And in the high resolution chest CT, patchy ground glass change and poorly defined nodules, area of increased lucency and enhance the HRCT occur due to air trapping from bronchiolar involvement. And in the prevention aspect, dry crops before storage, work in ventilated areas or outdoor, wet down dusty areas prior to working in them. Bed hay should be inhaled, keeping to stopping mold growth, and consider respirator. Now comes the recent updates. This is one of the article which is published in Pakistan Journal of Chest Medicine. Frequency of coal workers pneumoconiosis in patient presented to chest outpatient department, and description of these article is to find out the frequency of coal workers pneumoconiosis in patient presenting to chest OPD. And in the result section, a total of 223 male patients aged range 26 to 67 years with 7 to 27 years coal mining working history were interviewed, and they examined doing chest X-ray, pulmonary function test, and HRCT were done. Out of them, 142 had no findings, and among these 223 patients, 134 had finding on chest X-ray, and 89 had normal X-rays, and pulmonary function tests were abnormal in 157 patients having restrictive, obstructive, or mixed pattern, and 66 had normal spirometry. In HRCT finding, we were seeing that 142 patients had normal HRCT, and finding were seen in 142, and the normal HRCT were found in 81 patients. This is another article in which pulmonary function parameters among marble industry workers in Lahore, Pakistan. And what was done? The purpose of this study was to compare the pulmonary function parameters of worker in marble workshop and age-matched healthy individual in the Lahore district of Pakistan. The study included 164 male individual, 82 individual work in marble workshop, and 82 healthy individual for the same community. And the spirometry shown that pulmonary function test was used to identify any change in the lung function parameter and forced vital capacity and FEV1, force expiratory volume in per second. So FEV1 and FVC ratio were evaluated in these participants, and a statistically insignificant difference was observed between marble exposed worker and a healthy individual from the demographic variables. Lung function parameters in marble workers exhibited a high significant decrease in forced vital capacity ratio when compared to a healthy individual. 71% of marble workers had abnormal pulmonary parameters, where 34% of workers had restrictive pulmonary impairment. Marble workers who had worked for more than 15 years had a highly significant risk of developing abnormal pulmonary function test. This is another article in which frequency of silicosis and its relationship with dust and pulmonary function test in stone crushing industry workers in Peshawar. The true prevalence of silicosis is underestimated as during its initial phase, the patient is symptom-free. It is the commonest occupational lung disease all over the world, but is more frequent in developing countries, including Pakistan, where safe work practices among the worker is poor. And this is the cross-sectional analytical studies was carried out and the male worker of stone crushing industries in the sub areas of Peshawar. Now it's time for the multiple choice question. Coal workers' pneumoconiosis, which is also known as black lung, is a lung disease caused by deposition of coal dust in the lung. Which of the following is false statement about the black lung? It results from inhaling coal dust or graphite over a long period of time. It is the type of emphysema. Symptoms are more likely in smokers. It can cause disabling shortness of breath and it causes lung cancer.
E.
E is the right answer. Asbestos is widespread scarring of lung tissue caused by breathing asbestos dust. Which of the following is responsible for the largest number of lung cancer causing among people with asbestosis, like cigarette smoking, genetic predisposition, having other lung disorders, level of having other lung disorder, level of exposure to asbestos fiber, and level of exposure to asbestos dust. Cigarette smoking, A, is the right answer. Mr. Ali has been working in ceramic industry for last 12 years, developing fatigue, shortness of breath, loss of appetite, and chest pain. His chest X-ray showed ground glass appearance in both lungs. Which is your probable diagnosis? Accelerated silicosis, anthracosis, bagasosis, chronic silicosis, and acute silicosis.
D.
This is silicosis and the type is chronic silicosis. D is the right one. The patient XYZ visited a pulmonologist with complaint of cough and blackish sputum. His pulmonary function test showed slight increase in forced vital capacity. His chest X-ray showed 1 to 2 mm nodules all over the lung. On taking history, he told he was a coal miner for last 7 years. Which of the following is not true in this case? His condition is reversible. His disease would progress if his exposure is not stopped. He is suffering from complicated coal works pneumoconiosis. He is suffering from simple coal workers pneumoconiosis, suffering from lung cancer. C is the right answer. He is suffering from complicated coal workers pneumoconiosis. Some of the workers of coal industry ABC start developing cough, extreme shortness of breath, and fatigue, due to which they were not working properly. All were sent to the physician for medical checkup. Further referred them to a pulmonologist, making a diagnosis of coal workers pneumoconiosis. Which of the following is the best way to differentiate it between simple and complicated coal workers pneumoconiosis? Size of opacity on chest X-ray, severity of symptom, year of exposure in the industry, pulmonary function test, or a sputum examination.
D. Pulmonary test function. Pulmonary function.
A is the right answer. Size of opacities on lungs in chest X-ray. People working in textile industry are prone to develop a crippling lung disease due to inhalation of cotton fiber. The development of byssinosis can be prevented by all of the following steps: periodic medical examination, good personal hygiene, promoting dry cutting and prohibited wet cutting, conducting air monitoring frequently, and good ventilation system.
C.
Yes, C is the right answer. Promoting dry cutting and prohibiting wet cutting. A middle-aged man working in a shipyard industry for last 14 years, developing cough, hemoptysis, shortness of breath, hoarseness of voice, and weight loss. He went to the hospital for his checkup where he was diagnosed a case of mesothelioma, which is the main cause of mesothelioma, silicosis, anthracosis, asbestos, farmer's lung disease, and pneumoconiosis.
C.
C is the right answer, asbestos. Silicosis is the most common occupational lung disease caused by inhalation of dust containing free silica or silicon dioxide. Which of the following is not correct about it? It is not a reversible disease. It has strong association with smoking. It has strong association with duration of job exposure. It is of two types, acute and chronic.
B.
D is the right one. It is of two types, acute and chronic. Silicosis is the commonest lung crippling disease that has no cure but can be prevented. Which of the following is the best preventive measures when dust level is above the recommended dust exposure? Substitution of silica with other metals, wearing goggles and air muffs, frequent costume change and washing hand, wearing a respirator, and wearing personal protective equipment. Wearing a respirator, because the best preventive measure when your dust is above the recommended level of dust exposure, then wearing a respirator is best protective measure. A 40-year-old man working in grain market for last 20 years started presented with history of recurrent infection for last 1 year. His chest x-ray show pulmonary fibrosis. The likely diagnosis was tuberculosis, silicon tuberculosis, bagasosis, farmer's lung, or asbestos. Grain market for last 10 years.
D.
Farmer's lung disease is the right option. This is the key of my MCQs, YouTube link of my presentation, and thank you.